CTV family. Catch us live on your TV screens.
Do let us know what is your favorite amapiano or gom tune and show us how you dance to it. There is a new craze all around the world where people are showing their struts. You can do that by Nizithumelele Ekse_live. We are available on Instagram as well as on Twitter and YouTube, or Nizithumele via our WhatsApp line, which is 060-391-8464. TK just had a stellar interview with Whitney Smith. You know where to find her on the 15th of May, so that you enjoy yourself some opera music. On top of the hour, I did introduce the GoBe robot. Well, Jonathan Berger, who's the CEO of Nexmed, is in studio today to tell us about the telepresence robot. Oh, Jonathan, wow, what an invention.
Thank you so much.
It's been a milestone for everybody in the world. It's been a year, and like I said earlier on, I can't imagine people that are going through COVID-19 infections,
Yes.
that are admitted to hospital and they can't be with family and friends.
Yes.
I need to find out what's the inspiration behind your new project.
Perfect. Well, Alma, thanks so much, first of all, for having us on your show, and your team and your viewers really appreciate it.
Sure.
And basically, the idea behind the GoBe robot is exactly that, telepresence. So what it is about connecting people around the world in real time without physically being there. So that basically breaks down the barriers that we see and that we have. Like you said, with COVID-19 was a big milestone for this robot and for this device, because as you said, people couldn't see their family members. Doctors would become infected, with infected patients. So the robot's something, it doesn't get tired, it doesn't get infected. So we're able to send the robot in and communicate with either patients or with doctors at a broad level in real time. So we've seen telepresence around the world take a bit of a leap in previous years, but COVID-19 has really pushed the boundaries with telepresence. So we're now seeing a massive influx of that.
Sure. Does it reduce carbon dioxide emissions?
Correctly. Well, what we try to say is, if you look at the amount of flights necessary, if you have to travel as a business owner in the commercial space, and maybe you have an area like Durban, Cape Town, Joburg, etc., and you must travel there on a weekly basis.
Yeah.
Having the robot insert you at one of those locations means that you can log on from wherever you are in the world into that robot and have a real view of that premises without physically being there.
Sure.
So your travel time's reduced, your travel costs are reduced, and of course the CO2 that goes with the traveling.
You could be in London, you could be in Jamaica,
Exactly.
and you want to communicate with me.
Exactly.
How does it work?
So basically what happens is the robot's got a platform that you log onto via your phone or via your tablet or your PC, and you're able to control the robot from your tablet or your device. Sure. And you can basically move the robot around in real time. It all depends again on your connectivity issues and if everything's set up correctly. We are finding a few connectivity issues in Africa and South Africa, but basically we are starting to see a big uptake of this device.
Sure.
So you literally anywhere around the world, and you can connect to this thing.
26 hospitals are using it already?
Well, Dr. Stephen Holt, who's about to join us in a few minutes, is the CEO of ER Consulting, and they run 26 trauma units, and we're doing a pilot with their group to see the adoption of the telemedicine within their group.
Yeah. If these 26 hospitals are happy
Yes.
with what's happening, I can imagine that you are going to expand.
Exactly. It will be a major step, I think, in telemedicine. I think it will be a major step in healthcare. Because we're able to actually, push the boundaries of how we can treat patients,
Yeah.
particularly in rural areas as well, where there's limited access. So it's very good.
I love that you touched on rural areas because I wanted to find out what's the future of these robots.
So Lama, again, sometimes we struggle with connectivity in the rural areas, but what can happen in a perfect situation is if we have a rural clinic that hasn't got a lot of specialists on site, we can have one of those robots on site with the hospital, and we can have doctors from around the world consult those rural clinics. So the patients have access to the most amazing care from international specialists right on their doorstep with a robot like this.
Not everybody watching right here, right now, is a doctor or a patient,
Yes.
and they might get jealous and thinking, what about us? What if we want to use such a thing?
Yes.
Who and where can people use this robot if they are not in a hospital?
That's perfect. Thanks. I'm glad that you asked that question, because I think it's great to understand that it's also used in the commercial space. So it can be used in schools for people to do teaching. It can be used in the businesses. So if you've got a business and you have oversight of many sites, you can have the robot in your businesses. It can be used in airports, for the communication areas. It can be used literally in most segments where you need to communicate with people. And I think that's a great thing when it comes to reducing human-to-human connectivity, especially with the pandemic. It becomes actually a safety device.
I know that we are already using it here in Cape Town, South Africa,
Yes.
but where else in the world is the robot available?
Perfect, thank you. So the company that produces this, which is Blue Ocean Robotics, has this robot and has a network of over 60 countries around the world that's already using it. So Europe, America, Asian Pacific. and South Africa, of course.
Is it different from the UVD robot?
Yes.
And how different is it?
Okay, great. So the UVD robot is actually the disinfection brother to GoBe robots. And that robot actually does actual disinfection. So it's able to disinfect up to 99.999% autonomously. So it's a robotic disinfection device. So I'm hoping that we can bring it along sometime and show you guys and your viewers.
Hope so.
Yes.
What does it do again?
It's a disinfection device. So it's able to actually destroy pathogens at cell level. So it destroys it completely. So if you look at COVID-19, the SARS-CoV-2, it can destroy that. And many more. Yeah.
Wow,
Yeah.
you are a magician, I'll tell you that. I'm hoping that Dr. Stephen is in line right now so that we are able to chat with him and he lets us know about how it helped his hospital and his patients. Remember, we did ask you to send us 3 videos enjoying yourself some sweet sounds of Amapiano. Well, people did send through a video, Zabo, and we have time for one, and we should check it out before we chat to Dr. Stephen. Check this out. We are celebrating 27 years of our democracy. Africa Rising is doing something to ensure that we do know more about those things. JJ Prime is going to be sitting down with Craig Bright, who is organizing this humongous event that will be happening at Robben Island. There will be Indlovu Youth Choir as well as Master KG. We've got Maps Mampunyana, who's going to be the master of ceremonies. 80,000 rands worth of prizes to be won. To find out how you can win those, make sure that you do not go anywhere, because JJ Prime, after this quick ad break, uzobe engokolano Craig Bright, as well as Awonke chatting to a young fellow who is the new age Scotan Banaba Kumbula Babitandu Kutai Altramels Bazul is expensive. Beautiful music video that we're gonna be showing you as an exclusive right here on Ekse. While Jonathan is still trying to connect with Dr. Stephen, what are the feel-good stories that you've heard already about the GoBe robot?
Great. Thanks so much, Lama. So basically, the great thing with the robot is it's, again, the connectivity, you know? It's with joining people around the world who haven't got access to that. So we know that, number one, within COVID-19, travel restrictions were about, so you couldn't join your family from anywhere in the world, you know?
Yeah.
So having the robot in hospitals, as you said, or even in commercial spaces, allows you to communicate. So we've seen that's the biggest thing, you know? It's social inclusion, shall we say, you know?
Yeah.
So
while we're waiting for Dr. Stephen,
Yes.
maybe you can answer these questions on his behalf.
Okay.
When did he start using the GoBe?
perfect.
When did he
GoBe
start?
robot. So he actually started using the robot in January in a pilot system with one of his hospitals in Nelspruit. And what they wanted to use it for was telepresence.
Sure.
So actually in hospitals, you know, again, using the robot to communicate with patients and reduce that infected patient versus doctor barrier.
Doctor, welcome to the show. Are you able to hear us?
Yes.
Oh, sure. What do you use the GoBe robots in your ER units for?
There's a number of uses that we are trying and improve particular hospitals. The to extra doctors
Oh man, it seems like we have a poor connection with Dr. Stephen. Response from patients when Jonathan, what is it?
Yes.
Because I'm sure there are people that went through and they used GoBe.
Yes.
What's their response to
So
it?
Lama, basically in the beginning, it's a bit of a shock factor. You know, they see this robot coming into the ward. You know, it looks obviously like a human on wheels. You know, so it's a bit of a shock factor first. But once they start interacting with the robot, it's quite a joyful thing. You can see the expression. You can see they enjoy it. It's something new, something advanced, and it's got a very human feel because of its size. And so we've seen a very good response from the patients and even in the commercial sector as well.
Are you on Facebook?
We are on Facebook and all other places.
Let's follow you. What are the handles?
Well, we got on social media, it's Nexmed Health_SA. That's for Instagram, Twitter, Facebook, and LinkedIn as well.
Sure. Dr. Stephen just joined us now, but we don't have time. We're quickly going to a quick ad break. Awonke Dulaza, Kalisha's finest, is going to be conducting that interview. Don't go anywhere. Thank you, Doctor, for joining us.
CTV family.